Hello, St. Paul's. I'm grateful to be coming to you today with Bob Fox and Sam Hartwell, both parishioners of St. Paul's who are members of our Regathering Taskforce. And we'd like to share with you some of the discussions that we've been having on the task force around when it will be safe for us to regather in person for worship and programming. So to begin with, I would like it if Bob and Sam, if you'd be willing to introduce yourselves. Bob, why don't you go first?
Sure. My name is Bob Fox. I'm a staff neurologist down at the Cleveland Clinic, where I focus on multiple sclerosis and have been active in figuring out our approach to the care of patients with MS and also COVID, and trying to prevent the spread of COVID throughout our health system.
Great. Thanks, Bob. Sam?
Hi, I'm Sam Hartwell. I'm a lifelong Episcopalian, and I've been a member of St. Paul's since about 1983, and am junior warden. And if I'm not familiar to everybody, it's mostly because you probably don't get up at 7:45 on Sundays. I've been a regular of that service for a long time. If I can speak for a minute too, because we don't have the entire task force here, Jeannie, maybe I could tell you a little bit, or tell the group a little bit about some of the expertise that we brought together.
Sure.
Jeannie asked me to chair this task force as junior warden, and I'm happy to have done so. The first thing I said was, I'm not a business leader. I mean, sorry, I'm not a doctor. I don't know, the science, but I am a business guy, and my expertise is in hearing different perspectives and trying to synthesize solutions. And so I've tried to kind of corral the team a little bit and drive the discussion. It's a great group of people. We've met 9 or 10 times so far. We're now meeting really every couple of weeks because I think we're all very excited about getting back together. In fact, Jeannie, you may remember we started off as the COVID task force.
Right.
And very quickly changed our name to the Regathering Task Force because that's kind of what we all want to do. We've got 8 or 9 people on the group. We've got 2 epidemiologists, actually. Our senior warden, Liz Patterson, trained as an epidemiologist, even though she's a teacher now. We've got an architect, we've got a couple of business leaders, we've got Bob as an MD, we've got a lawyer, and more importantly than the expertise these people bring, we've also got a broad range of ages. We've got parents with kids in the various youth and youth ministry programs. So we've got a really good representative mix of the parish.
Great. Thanks, Sam. So Bob, why don't we start with you? What do we know about this virus currently that we didn't know a year ago or even 6 months ago? And how does that knowledge inform our best practices?
Yeah, well, it's a great question because it highlights how we are continually learning things about this virus and about the pandemic and about how best to prevent people from getting the virus. But a couple things that we know now. One is it is a very serious infection. It's a very serious infection, particularly in people who are older and people who have other medical conditions. So not everyone is equally susceptible to this virus. We know that it's very infectious. It's very easy for one person who has the virus to give it to another person. Mm-hmm. We also know that it's easy to have the virus and not even know it. So many people, particularly in the 2, 3, 4, 5 days before they get symptoms of the infection, to have the virus and to be giving it to other people. We also know that there are ways to prevent giving it to another person. So wearing a mask, social distancing, and hand washing, we've come to find is very, very helpful in preventing the transmission or giving it from one person to another. And now we know that vaccines do work, and we'll talk a little bit more about vaccines in a moment, but that's an important step forward in that vaccines are helpful in preventing the transmission of the virus from one person to another.
Great, thank you. Sam, can you tell us a little bit about the data that the team is tracking and about the local conditions currently?
Sure. We, all of our meetings, we track all of the state data and the county data that's available. I'm thinking of the Ohio State dashboard.
Mhm.
We're looking at infections, we're looking at deaths, we're looking at hospitalizations, we're looking at positivity rates in testing. Our focus is on Cuyahoga County, obviously, because that's the county where we are, but we do look at contiguous counties and think about kind of what their experience is. And our discussions are really facilitated by one member of our task force, one of the epidemiologists, whose role is really critical in tracking infections across the state, right down to the very local level. And so she can offer us insights into what infection rates are very, very locally by, by neighborhood, really. And so in all our meetings, she can talk a little bit, more than we can even see in the data that's available to us.
Good, right. Bob, even with a vaccine, the government is advising all of us to continue safety measures, except in a very small groups of people who are fully vaccinated. And so can you explain why?
Yeah. So it's important to realize that the vaccine studies, the clinical trials that evaluated the vaccines, were done at a time when people were wearing masks and people were social distancing by and large and washing their hands. So the amount of the virus that was able to be spread was limited by those actions. And so the effectiveness of the vaccine was evaluated in those settings. So we don't know how well the vaccines work if we're not masking and we're not social distancing. The other aspect is that these studies were done before the variants of the virus have developed. And so now we have variants of the virus that, one, are even more infectious and cause more serious illness than the previous versions of the virus that were circulating last summer and last fall. And we know that the vaccines are not quite as effective. They're still effective and they're still important to get, but they're not as effective with these new variants as the vaccines are to the original version of the virus. So for all those reasons, it is important still, even in people who have been vaccinated, to continue masking and continue social distancing.
Great, thank you. Sam, can you talk a little bit about how we balance the spiritual and mental health aspects of the ongoing pandemic with the safety needs of our parish over the next several months?
Yeah, well, that is the question, isn't it? It really is, and I know it's the question that's foremost on our minds as we meet, and I think it's probably foremost on the minds of anybody here. One thing I'd maybe preface my remarks by saying a little bit, notwithstanding the fact we haven't been physically together, I've been really impressed as junior warden with the breadth of activities that the church has been able to take online. We've been incredibly active. Ministries are meeting regularly, lots and lots of Zoom calls, lots of worship, lots of services. It's not the same as being in person, but we have been doing just a vast amount of stuff. And in fact, I think our Sunday attendance is up something like 30%, we reported. So even though people aren't coming to church, we've got more people paying attention to what we're doing. But it's not the same, and we recognize it's not the same. And I think people are anxious, especially as the second Easter comes around when we can't be together. I think people really, really want to get back into the nave and into worship, and we all do too. We've planned a slow kind of introduction back into worship when the numbers indicate that it's safe to do so. The first, and we'd like to do this as soon as possible, is just to begin to open up the nave for private contemplative worship. So for periods of time, we'd have blocks of time when groups of people could come in and be masked and be separated, but spend some quiet time in the nave, perhaps even with music in some of those offerings. With the spring we've had so far, it would be great to get outdoors, and we'll get outdoors just as soon as we possibly can. We had a nice service or two last fall, and we should absolutely pick back on that. And then we'll get back inside as soon as we can. And going into the late spring and summer, it will be easier because we'll be able to have windows open and have ventilation that won't be problematic. So, I think the next few weeks are really going to be critical as we look at the trends. And the question we're asking ourselves in the meetings every time is, is it time to reopen? Is it time to reopen? So that's kind of, we can offer hope, and Easter's a season of hope, of course. And, we also have to acknowledge the Lent that we've been through, which has now been going on for more than a year. Lots of time, but I think we can look forward to getting back together fairly soon. And I'd encourage anybody who's not actively engaged with all the things that the church is doing to, until we can get back together, to log in on a Sunday or Lent series or any number of the offerings that are online.
Great, thank you. And Bob, we've heard that worship will be different for a while. So can you talk a little bit along those lines?
Well, it will. And as we've talked about, we need to continue masking. We need to continue social distancing. So as we consider getting back together for worship in the ways Sam just described, we will have to continue those things that we know prevent transmission of the virus or passing the virus from one person to another. We've learned, and unfortunately we've learned this the hard way, that singing leads to a very high transmission or passage of the virus from one person to another. This is because the virus spreads through water droplets, and singing leads to water droplets coming out of our mouths as we're enthusiastically singing and praising. Unfortunately, that leads to a lot of virus coming out from people who have the virus. And so singing is something that will be coming very late as we regather and come back together again for worship. Now, things will get better as people continue to receive the vaccine, and I encourage everyone to consider receiving the vaccine. Some people don't want to, and that's a personal choice, totally fine. But if you're willing, I do encourage you to receive the vaccine when you are eligible. And as more and more people get protection from this virus through the vaccine, things will improve. I don't know when they will get better. I'm optimistic that over the coming months and into the summer, we will see improvements in the rates of infection. We know our epidemiologists are collecting this data very diligently, and so we have very good insight into this, which is great news. And so I am optimistic that things will get better over the coming months and into the summer. Slow and surely, we will be able to get back together.
Great. Bob and Sam, thank you so much for your time today. I'm so grateful for today and for the input that you bring to the regathering discussion. So thank you so much. Just a reminder to the parish that in addition to receiving recommendations from this task force, I also stay in touch with my Episcopal and ecumenical colleagues in the area to hear what their thoughts are around gathering together. All of us are encouraged by the cases declining, but we're also heeding the advice not to jump too soon. We're so close to getting through this. So we're monitoring it very carefully. We will continue to stay in touch with you as we're able to open up again. We're hoping that not long after Easter, we'll start being able to schedule time for people to come in to the nave for personal prayer. So thank you all. Stay well and God bless.
Thank you, everyone.
Thank you.
Stay well.
Thanks, Jeannie. Thanks, Bob.
Thank you.